Hi, my name is Emily Jones, and I will be discussing the management of dementia and Alzheimer's for my health promotion topic. So first, we need to talk about what dementia and Alzheimer's are. So dementia is kind of an umbrella term, which is used to encompass like types of brain disease or any injury, which is marked by memory disorders, personality changes, impaired reasoning. So there are a lot of different types of dementia. We'll just focus on a couple. One type of dementia is frontotemporal dementia. This is a neurodegenerative disorder of the frontal and temporal lobe pathway. Typically, the age of onset could be anywhere between 35 to 75 years old. It really shows distinctive language and behavioral changes, and signs of this type of dementia are that people are impulsive, inappropriate, they have a lack of judgment and a lack of initiative. Another type of dementia is Huntington's disease dementia. So this is a pretty rare and inheritable disease. The onset occurs between 40 and 50 years old. And with this, you can see signs of chorea, difficulty planning, and difficulty organizing thoughts. And with this disease, death can be expected typically 10 to 20 years after onset or diagnosis. And then last, we have Alzheimer's disease, which is the most common form of dementia. There are 3 stages: the early stage, intermediate stage, and terminal stage of Alzheimer's. The signs are that these people could be forgetful, they repeat a lot, focus on repetition, and they could be confused. With Alzheimer's, there is an intellectual decline, problem with sequential activities, following steps. They have a difficulty retaining new information, and they have language difficulties, impaired impulse control, and impaired judgment. This population also has problems with negotiating their familiar surroundings. So they can be disoriented in their home or in their neighborhood, so they need someone to help them out with that. They also experience emotional changes such as irritability, hostility, and agitation. So working with this population, you need a specific set of communication styles. So it's important to remember 55% of communication is body language, and it's important to understand what is not possible to change. When working with this population, remember to repeat what you're saying often. Always accept blame. If it is not going well or they're not able to remember or agitated, just leave the room and you can try again later. It's always important to agree with the patient. If they're getting off track, you can distract them, redirect them back to the topic at hand. Remember to use short sentence answers and to be patient and be cheerful when working with this population. Things to not do is don't reason with them, don't argue with them. You don't need to remind them of things that they've already forgotten. Don't question what they tell you, and also don't take things personally. So in occupational therapy, these are a couple guidelines for care for this population. It's important for them to maintain their routine. Consistency is key. If you're going to introduce change, do it gradually. Small steps will help them a lot. It's important to maintain their orientation so that way they're able to stay centered and be familiar with their surroundings. Continuously monitor their health and maintain open communication with them. When treating them, use humor and laughter and positive reinforcements, and also you just want to help them feel safe and secure. There are a lot of roles of occupational therapy for working with this population. Here are just a couple. OT really works on health promotion, optimizing their health, their functional independence, optimizing their safety and quality of life, and then also education. They want to train different caregivers and care partners, make sure that everyone is on the same page with treatment and all of that. For this presentation, I looked at a couple different interventions. The first article I found looked at a home-based occupational therapy intervention program. This article talked about how a group of people tried the same home therapy home therapy intervention for, I think it was like 6 months to a year. And it really focused on enhancing their meaningful tasks and activities, focused on cognitive stimulation, activation of their psychomotor and sensory skills, home modification, caregiver counseling and training, and independent in daily living skills. And this study also found an increase in their functional independence and improvements in many of the areas that were addressed. And it found that this client-centered occupational therapy program could be an effective approach to delay functional disability and the loss of some cognitive functions. Another article I looked at just kind of went over a bunch of different interventions for occupational therapy to treat the dementia population. So it looked at ADL training or activity modification to improve or maintain ADL performance. Like I said earlier, this population could be easily irritable, so using ambient music to improve their behaviors. Exercise interventions to improve or maintain ADL performance, which includes functional mobility and sleep. And then also communication skills training to promote caregiver quality of life and well-being, because we need to remember we're not just treating these patients, we're also treating their caregivers and those who interact with them on a daily basis. Lastly, here are a couple ideas for health promotion for this population. We can do either crafts and creative activities, but also exercise and physical activities. So some craft ideas would be drawing and painting activities, puzzles, matching games. All of this can be set in a room with like music that they're familiar with playing in the background to help orient them and get their brain like recalling memory and all of that. You can bake cookies, cakes, cook, whatever they are interested in. It's important to use meaningful occupations for therapy for them. And then also doing easy word searches or crossword puzzles to really work on their brain cognition. And then you can also do some exercise and physical activities such as yoga, tai chi. I saw an article where there was a dementia swimming club. So it's people who have dementia and their caregivers. They all come and swim together in a class. They can just really get to know this population, have sounding boards for what works and what doesn't, and see other people who are in a similar situation as themselves. It's also just get out and walk around, get their whole body moving, or participate in a gardening activity, which could also be a great way to get their brain and body working together and help promote physical activity and mental awareness. And these are my references. Thank you for watching my presentation.